One problem is that, and I got into talking about substance abuse and working with substance abuse patients with ADHD by some people who were doing a substance abuse program, and they said, after the hearing one of my presentations, that they thought a lot of their patients who didn't respond to their treatment, the substance abuse treatment, and this was a 30-day program, they thought may have attention deficit disorder. And so they then said to me, let's do a study, let's look at it, of the people who failed in their substance abuse program. Let's evaluate them and see if they had substance abuse. And matter of fact, the majority of them did. So the majority of people who failed substance abuse programs had a comorbid ADHD that was not being treated, and we felt that that was why they didn't respond as well to their substance abuse program. So I want to talk today about some of the controversy about using medications in mental health conditions and substance abuse, the comorbidity of substance abuse and other mental health disorders, and then talk about some of the new research, which is absolutely fascinating, that's coming out by Norma Valkow on substance abuse disorders and some of the physiologic. We now have PET scans that can look at the metabolism in the brain of patients with ADHD and with substance abuse. And I understand yesterday you all had a presentation about some of the neurophysiology about attention deficit hyperactivity disorder, and I want to add a little dimension in terms of also the substance abuse. There's a great deal of concern and fear that has gone on for a very long time about the use of ADHD medication stimulants with substance abuse patients. There's concern, and I've given a presentation about this to substance abuse workers, people in the field who are doing the work, and their concern is if you use medication, then people won't do the work. You know, they won't do the work, the psychosocial component, they won't do the 12-step. That because of their addiction style, that they'll just depend on the medication. The other piece of it is that people say when they take medication for mental health disorders, it's very interesting, this separation, that I'm not crazy. Why should I be taking crazy medicine? Why should I be taking psychiatric medicine? I have a substance abuse disorder. As if there's really a separation in the brain between these things. I think medicine has always been, a linear process, and it's changing to a more biopsychosocial. And the biopsychosocial is everything is integrated. You can't look at the individual and just separate the brain from the rest of the body. You can't separate the brain from the mind. There is a relationship to all these things. And you can't separate the person in terms of, as an individual, separate from their family, or separate from their school, or separate from their community. To really be effective in our treatment, and also diagnostically, you have to take a biopsychosocial approach. So, in my view, I don't treat people, I don't diagnose people unless I'm looking at it from a biopsychosocial approach. So in my treatment approach, and in my center, we look at mental health disorders, we look at attention deficit disorder, substance abuse disorders from a biopsychosocial perspective, and treat it that way.